Hello, everyone. Welcome to our fourth patient education seminar from the Women's Health and Wellness Institute. We have three great clinicians with us today that we're really excited to talk about alternative treatments for depression. So the Women's Health and Wellness Institute, part of our vision and our mission is as a community resource, which includes patient education. It also includes physician education. So some of these same things we do for physician groups, and there's physicians on as well and present. So, but one of the things that came up both from physicians and from patients is what all are the alternative treatments. So the current statistic for adults on antidepressants is 13% of people have been on antidepressants in the last 30 days. And that extends, back years. I think the data goes back until about the 2000s. That number is higher in women than in men. And there are alternatives. And so our speakers today are going to talk about what the alternatives are. Why would you not want to be on antidepressants? There's certainly good indications for them. And so we are going to hear from them, and then please put questions either in the chat or we'll take some from the people here. And we're looking forward to this. So our first speaker is Shannel Elhelou. She is a neuropsychologist at the Brain Wellness and Lifestyle Program, so kind of like us, but she's at the Pacific Neuroscience Institute, and she specializes in brain health and coaching, cognitive rehabilitation for aging adults, and we are super happy to have her here. So Shannel, come on up. Our format is that each of them is going to speak for about 5 to 7 minutes. They're going to talk about things that they think are important, and hopefully that will foster some questions, and they'll all be around, and we'll do Q&A afterwards. So here is Shannel.
Hello, everyone, and thank you so much for having me here. So I am Dr. Shannel Elhelou. I'm a neuropsychologist within the PNIF Lifestyle Program in the Pacific Brain Health Center. And here you'll see my team. We work together as neuropsychologists, geropsychologists. We specialize in cognitive training, exercise, and nutrition. And really our goal is to support lifestyle behaviors or teach people lifestyle behaviors to support quality, longevity, and brain health. Now, I want to start off with some myths and facts about alternative or about depression in general. And so one myth that I often hear is that depression is just a chemical imbalance. But the fact is it's a complex interplay of brain function, inflammation, stress hormones, and environment. So there's much more involved than just a chemical imbalance. Another myth is if you're depressed, just think positive. I don't know if anyone in the audience has heard that before, but that one could be quite frustrating. But the fact is that depression affects cognitive processing, making positive thinking difficult without proper strategies. Another myth is that medication is the only effective treatment. Now you have more options. So treatments like therapy, exercise, nutrition, and lifestyle changes can be effective, especially for mild to moderate depression. And another myth is crying is a sign of weakness. But the fact is that crying is a natural emotional release that helps regulate stress and promotes emotional healing. And another fact is seeking help is a sign of strength, not weakness. Now let's get into exercise and movement. So exercise can be a powerful antidepressant. It changes the brain structurally by increasing BDNF, a protein that helps brain cells grow. And regular movement, especially activities like walking, yoga, and strength training, has been shown to significantly reduce depressive symptoms. And a general recommendation is about 30 minutes, 3 to 5 times per week, but that really can look different for everybody. Now let's talk a little bit about nutrition and gut health. So the gut and brain communicate constantly. A poor diet increases inflammation and negatively affects mood. And so studies show that people who follow a Mediterranean style diet have lower rates of depression compared to those who eat maybe processed foods high in sugar or unhealthy fats. Now let's get into social connection and community. So social connection is a major factor in mental health. And so prioritizing friendships, joining groups, or engaging in meaningful conversations can significantly reduce feelings of loneliness, depression, and isolation. And so there are different things you can do. You can join groups, social support groups. You can even join something like you are today. Being part of this community together, even though you can't all see each other, you're still connecting with your community. You can engage in volunteering or group activities. There are so many different volunteer opportunities out here in Santa Monica, and there are different websites you can go on online to see what you have available in your local areas. And there's a website, something called meetup.com. It's a great place to go where you could find other people with similar interests as you to connect and really prioritize meaningful connections. So it's not about the quantity, it's about the quality. And then we'll talk a little bit about sleep and stress management. So sleep and stress are deeply connected to depression, particularly REM sleep is closely connected to emotional processing. And I know for myself, when I don't get enough sleep, I can be kind of irritable and a bit emotionally down. And so sleep is really, truly so important. And stress-reducing activities like nature walks, breathing exercises, and even gratitude journaling can be powerful tools. Now let's talk briefly about some therapeutic approaches. And so cognitive behavioral therapy, also known as CBT, focuses on identifying and challenging negative thought patterns. So the idea is that our thoughts, feelings, and behaviors are all interconnected. So if we can change unhelpful thoughts, it can help improve how we feel and act. So for example, someone who thinks I'm a failure and nothing will ever change might work in therapy to recognize that this thought is not necessarily helpful or true. And so maybe they'll learn some cognitive restructuring to replace the thought with something more balanced. Like, I've had challenges, but I've also had successes, and I can take small steps forward. CBT also emphasizes behavioral activation, helping individuals engage in enjoyable or meaningful activities, even when they don't necessarily feel like it. So what this helps with is really breaking that cycle of avoidance and really pushing you to engage in activities that help with low mood. Now, acceptance and commitment therapy is one of my favorites. We call it ACT, and so really ACT takes a different approach. Instead of challenging negative thoughts, it teaches people to accept them without letting them control their actions. So the goal is psychological flexibility. So learning to live meaningfully despite difficult emotions, because difficult emotions happen. And so ACT encourages mindfulness techniques, which really helps individuals observe their thoughts without getting caught up in them. And so a key tool in ACT is something called diffusion, where we learn to detach from negative thoughts instead of believing them completely. So for example, instead of thinking I'm a failure and accepting that as truth, ACT teaches people to step back and say, I notice that I'm having the thought that I'm a failure. So this small shift can really help reduce the power of the thought and kind of disconnect it from yourself. ACT also really focuses on values. So helping people identify what truly matters to them and take action in those areas. And so, for example, on a day I'm feeling down, I may be less motivated to engage in more of behaviors that I value, like going for a walk or spending time with family. But instead, I might look at my list of values and say, okay, these are my options of behaviors to engage in that tend to feel good. I'm going to go ahead and do it anyway, even though I'm not feeling like it. And so the biggest difference, CBT works by changing thoughts, while ACT works by changing our relationship to the thoughts. Both are effective and really can be tailored to you. And so some people may benefit more from one than the other, and many therapists will actually integrate both approaches. The key takeaway is that depression doesn't mean or need to make you feel stuck. There are options for long-term changes. And so just some final takeaways. There's no single cure for depression, but there are multiple ways to improve symptoms. Medication is a tool, and for some people it can be helpful, but it's not the only one. So by incorporating lifestyle changes and supportive therapies and spending time with friends, many people can experience some significant relief. The key is consistency, a personalized approach, and just making small changes, small steps along the way. Thank you.
Thank you so much, Dr. Elhelou. There's already some questions, but I think I'm going to wait until everybody's had a chance to present, and then we'll be able to have all three of our panelists answer them. So our next speaker is Dr. Marki Knox, who is an OBGYN for 45 years. You would never know it to look at her. She's been a big part of the community, has a huge commitment to women's health, and now has a focus on perimenopausal, menopausal hormones. So she is our newest medical director around hormone health, which is obviously has far-reaching implications, and we're super excited to have her. So come on up. There you go.
Oh, there I am. Yes.
There you are.
Thank you.
And you don't have slides, so I'm just going to go
No.
back to this. Well, maybe. All right, go ahead.
So thank you for that lovely introduction. I am certainly not here to dispute the benefit or the need for antidepressant medication. But what I would like to speak to is what I see, and many of us who treat postmenopausal and perimenopausal women see, is that so many of our patients present having been given antidepressants because either they or their caregivers fear the use of hormone replacement therapy for the types of depression that can occur with menopause. So what I'd like to speak to is briefly how these fears came about and how we now have answers to them and solutions for them. So what used to be thought of as the dangers of hormone replacement, we now recognize that there are no downside risks to it if it is done appropriately and with the proper agents. But the journey was a difficult one. And part of it has to do with the fact that over the last 80 years, we've added 30 years to women's lifespan, which means that most of us are going to spend probably a third of our lives in menopause. We recognize that the early ventures into administering hormone replacement therapy were flawed in so many ways, well-intended but flawed. And fortunately, we've learned from that. And what we know now is that the benefits long-term to hormone replacement therapy include much better mental health. We'll come back to that. Includes protection against bone loss, includes protection against heart disease. In fact, some protection against breast cancer, as we now understand it, protection against colon cancer, and protection against the complications of type 2 diabetes. So there are ample medical reasons why we should be embracing this therapy. But in order to do that, we have to make people understand that it is now recognized as safe. And I can get more into that in the question and answers if you like. But one of the things we know, the first presentation of many perimenopausal and just entering menopause women is depression and mood alteration and anxiety and fearfulness and agitation. And all of that has to do with the fact that with the absence of estrogen, sleep is disturbed, so is memory, so is ability to concentrate. And if that were the only time that happened, then perhaps the use of antidepressants would be appropriate. But those things do not improve over time, and the medical risks of being estrogen deficient don't really manifest visibly until probably within the next 2 to 5 years after menopause occurs. So it is really important for us as a community to come together and talk to all caregivers about the benefits of hormone replacement therapy and be able to reassure them that this is in fact a safe and appropriate treatment. And it doesn't mean that occasionally there will be a patient that needs both hormone replacement and may need antidepressants, but they are not, antidepressants alone are not the solution to the symptoms that the majority of perimenopausal and menopausal women present with. And that has to do with all the impact on mental function that antidepressants can't fix. So, thank you. I will allow questions.
Cut it short. Well, and that's okay. There's already a bunch of questions, so we'll do those afterwards. Do you want to help me get Dr. Yafai up here? So while our amazing Megan is fixing the computer, so Dr. Sharry Yafai, she's an emergency medicine physician. She's also an expert in cannabis-based medicine. She is also one of our medical directors at the Women's Health and Wellness Institute of the Integrative Medicine department. And so she has a private practice called the Releaf Institute, but obviously has helped us to design all the parts of integrative medicine, which include acupuncture, CBD, nutrition, physical therapy. So she's going to give us her take on the alternative treatments to depression. Dr. Yafai, are you there?
Hi.
There she is. Excellent. The beautiful Dr. Yafai. Thank you for taking time out from your shift to do this for us.
You got it. Thank you for having me. This is always an interesting topic. I think I should be able to see my screen share right now. Yes. Again, thank you for having me, everybody. The prior two speakers were also amazing. We're going to overlap a bit about what we were talking about alternative therapy for depression. My name is Dr. Sharry Yafai, and as Dr. Grunwald mentioned, I'm the Medical Director of Integrative Health at the Women's Health and Wellness Institute. And I wanted to take a quick step back before we dive in and just talk about the different types of depression, because I think it's really important to know that not everything is the same. We kind of tack on this big word of depression, and we forget that there's kind of other parts to it. So one part that we focus on at the Women's Health Institute is postpartum, peripartum depression that can come on really within the first 12 months after you have a baby. There's seasonal depression, there's major depressive disorder, there's thymic disorder, which is kind of like a mild version of depression, if you think about it that way. And then there's chronic pain and cancer and other medical diagnoses that lead to depression. People get very upset and then sad when they feel like they just can't stop their neuropathic pain, when the shingles pain will go away, when they've got post-traumatic neuralgia, when they've got reflex dystrophy symptoms, when they've thought pain that just isn't getting better. And quite frankly, there's a lot of texts promoting any progress. Can't make better.
So it's really important as we kind of pick apart these different types of depression that we know there's specific types and things that can be helpful for one type that's not necessarily helpful for another. There was a great article in 2011 talking about complementary and alternative medicine for the treatment of major depressive disorder. I added 2 parts to it, but this was really entirely from that article. So number 1 is complementary therapy, things such as acupuncture, YNSA, which I'll get into in just a moment, cannabis and hemp. Diet changes. We had a previous speaker who spoke about this, but flax, soy, canola, walnuts, omega-3 sources, increasing fish consumption, exercise, and I'll get into all of these in more detail, but aerobic, resistant, or mindfulness exercises, sleep. This is really valuable as continuous sleep is very important. This can vary per individual, somewhere along the lines of 6 to 8 hours. I have some patients who are like, I need 10, and that's what I need, and that's fine. And noting that naps can always supplement that. And then vitamins such as St. John's wort, folate, omega-3, and psilocybin. Again, these are all, some of them are new, some of them are old, but I hope that I can bring a couple of really interesting perspectives here. St. John's wort, this is an actual photo of the flower of St. John's wort. I think it's always interesting to see what these things look like in real life. And this comes from 29 different double-blind randomized controlled trials comparing placebo and antidepressants using anywhere between 500 and 1200 milligrams daily. And what they found was improvement in depression symptoms with less side effects compared with our antidepressants. These cannot be combined though. This vitamin in particular is a bit finicky. So it's really important because it can't be combined with SSRIs, tricyclic antidepressants, or MAOIs because it can result in serotonin syndrome. It also cannot be combined with some chemo or immunosuppressant agents because it can cause side effects and problems. Why is this so important? Because for a long time, we were seeing a lot of people on St. John's ward, and in the emergency department, it would be a question we would inherently ask because we had to make sure this wasn't the source of the problem that landed them in the emergency department. Vitamins, as I mentioned earlier, the other ones are things like folate. So I wanted to show you 12 pictures of foods rich in folates. It's very common in the greener food items. That's a good way to remember where it's coming from. And folate deficiency can be a result of medications as well as a result of decrease in your food or diet. Something really interesting I learned is folate and iron can be helpful in restless leg syndrome and also helpful in peripheral neuropathy. Again, thinking back to things that cause disruptions in our lifestyles and things that cause chronic pain and problems. Exercise, as mentioned earlier, this is really important. It releases endorphins, it lowers cortisol levels, it alters neurotransmitter function, and promotes growth of the hippocampus where our memory function is. It can actually be aerobic, which is working up a sweat, right? Things that get your heart rate going, resistance type or weight training, or mindfulness, like a yoga type of exercise. They are actually have all been found equal in effect on depression, which are all positive. Increasing duration of exercise improves outcomes. It also diverts you from actual negative thinking. It's a potential social contact, and it's very important in situations such as postpartum depression, where part of that is missing from our lifestyle after babies. Acupuncture. As we mentioned earlier, this is another potential therapeutic way to help with depression. It's the Chinese system of using needles on the back to help relieve stress, pain, and symptoms of depression. It can help result in the release of neurotransmitters, decreased activation of pain associated in limbic areas, changes in CSF biochemistry. Nowadays, we're seeing the attachment of electrodes to needles to deliver a pulsed electrical current. I can attest myself to having had back pain and using this, and it was fantastic. One of the most exciting things we wanted to bring here today was that this is now available at the Women's Health and Wellness Center by referral only. So if you are interested in pursuing this pathway as a pain tool or management tool, please let us know and we can refer you over. YNSA. Now this is a really new cutting edge here locally, not so much overseas, but this is a cutting edge new type of acupuncture. It's focused on doing cranial acupuncture in order to do pain treatment, and specifically on neurological and pain disorders. The biggest difference being that it goes in your scalp as opposed to into your back or neck or muscle areas, and that the needle is smaller and more shallow insertions. So, what does cannabis and hemp look like as it relates back to pain as well as depression? There are many different formats. This picture is a picture of what the plant actually looks like as it comes out of the ground and blossoms and blooms. There's so many different types and formats these days that it's really important that you think of it as more than just something that is smoked. But oftentimes, for about 95 to 99% of my patients, we're using this as a tincture, a topical, or as an edible. There are other modalities such as vaginal suppositories as well as rectal suppositories and more. There's about 8 different cannabinoids, and that's specifically different chemicals coming from the plant, such as CBD, THC, probably the 2 most famous. And then there's CBDA, THCA, CBG, CBN, THCV, and CBDV. These can be combined with MAOIs, SSRIs, and tricyclic antidepressants, which is a big difference from something like St. sports vitamins that we're using as another type of supplement. This also can be combined with the chemotherapies and immunosuppressants. So what are the goals of care with cannabis? Patients with cancer diagnoses, it's been shown that the second you receive a cancer diagnosis, you are more likely to be diagnosed at the same time with anxiety and depression. This is a very overwhelming diagnosis to the vast majority of individuals. And so we can use cannabis to help ease a lot of those anxieties, sleep disorders, as well as a treatment adjunct for cancer. Patients with chronic pain, especially in the line of neuropathic pain, as well as musculoskeletal pain, do very well with cannabis treatments. And once they get treated and once their pain is improved, not even has to be resolved, but once the pain is improved, people usually are able to re-engage in positive environments. They're able to re-engage in their life. And that in and of itself tends to help resolve the depression. Now, there's one other group that I haven't really touched on, but I found a really interesting article looking into this evening's lecture about fibromyalgia. And if anybody knows anybody with fibromyalgia, it's very commonly linked to things like anxiety and depression as well. And this particular study was a study done on all women, and the average age of women in the study were about 52. And what they found was using a THC-dominant cannabis tincture, these patients all had significant improvement on the feel-good, pain, do work, and fatigue scores. And there were no intolerable adverse effects. That's pretty impressive to get that type of outcome from a medication. Here is one of the other studies looking at chronic pain and medical cannabis. And as you can see, starting from the baseline, which is the big blue line, the number 9, all the way to the 12-month follow-up, where the pain scores were down below a 6 to 5. This was with patients with arthritis, neuropathic pain, radiculopathy, headache, and various forms of other conditions. Here's another article that we had talked about earlier about patients with fibromyalgia getting much improved with cannabis oil tinctures. Now, one last thing I want to touch upon is mushrooms. This is one of the newer studies that's being done here at St. John's through the Pacific Neuroscience Institute. There is a current study going for postpartum women and psilocybin who are experiencing major depressive disorder. The idea behind mushrooms and psilocybin is that it increases neuronal communication. And the question really becomes, is this an experiential event? Is this a one-time dose versus a microdose that you are using daily? These are part of some of the questions that they have, and I'm looking forward to seeing the results of those. If anybody is interested, we're always happy to refer you over to that group as well. Okay, questions? I tried to get through this really quickly. I know there was a lot here, but I wanted to make sure we got to questions. If you do want to reach out for an appointment or if you have questions, you can always reach out to me directly at sharry@mdrelief.com. And this is my website, thereliefinstitute.com.
Thank you so much. That was great. Well, 3 very different perspectives, right? We have like the psychotherapy, neuropsychology viewpoint, the hormone viewpoint, and then kind of the integrative medicine, herbal approach. I probably didn't say any of that right, and you guys would dispute it, but you know what I mean. So I have a bunch of questions here. I'm going to start with one, and I'm actually going to do 2 of them. One was, can I just go on antidepressants for a short period of time? And then the related one is, if I've been on antidepressants and I'm happy, do I need to take a break? Why do I need to try these things? And so I'd love to hear from each of you. And Dr. Elhelou, why don't we start with you?
Yes, absolutely. So I do get these questions in my practice, and I really do like to refer to a psychiatrist to really go in depth on it. But one thing that I will say is if you are currently taking antidepressants, definitely consult with your doctor, with your medical provider before making the decision to stop taking the medications, because there could be some negative side effects, and you would definitely want that to be done with your medical provider.
Well, I would say that for those women who need antidepressants, who are not going through menopause, I wouldn't recommend taking a break. If it's working, it's working. But I think, my whole issue is I see so many women that are on them without it addressing all of the needs that could be better addressed by going over the benefits of hormone replacement with them.
And Dr. Yafai?
So I see this issue pop up often. Number one, if you are doing well with a medication, that is pretty miraculous because not everybody does well. So it's really important not to kind of get freaked out about a medication and just stop it just for the sake of stopping it. If you are doing well on something, continue and do talk to somebody, but I don't think it's important to just stop. If you're not doing well on a medication and there's issues that are still popping up, if you're still having sleep disorders and anxiety and panic, then yes, absolutely. First of all, there's multiple options within the community of antidepressants. Number two, hormone replacement therapy might be an option. But again, depending on what the source of the depression is this just a psychological depression? Is this rooted in postpartum issues? Is this rooted in pain? That's really going to help you navigate towards which other option you want to go down. It's also very important not to stop any of these medications quickly, right? You don't want to just go cold turkey off antidepressants because it will cause other problems. So really the key is going to be to slowly wean off those medications alongside a provider, a physician, and then also get to the root of the real source of what the problem is so that you can better treat the problem or better treat the depression.
So, you guys are talking about a bunch of different stuff, and there's a couple of questions that kind of dance around this, but it sounds like a lot. So now I have to have a psychiatrist, I have to have a hormone health coach, I have to have a Dr. Yafai to help me with this stuff, or I can just take a pill. So can you guys talk about maybe one example of a patient and how they managed this, either a transition or just, how do you do that? It's a lot.
It's a lot.
Anybody who wants to start?
I can go ahead and start if you guys would
Yeah,
like.
absolutely,
Sure.
please.
Yeah, absolutely. And so it is absolutely a lot. And, one thing that we're not mentioning here are that there are other medical appointments too that someone is managing as well. So this is really just in the treatment of depression. And really, actually, the research shows that some of the best results come from medications combined with psychotherapy. And so it is a bit tricky. And, someone might have the thought that I'll just take a pill. And for some people that does work. For other people, it doesn't. And so it is important to find what works best for you. And it's also okay to seek support along the way. And there are different ways to seek support. So let's say it's difficult to actually get to the doctor's office. You can actually meet with someone on Zoom, and that could be much easier. Or seeing someone that you can see through your insurance if finances are a problem. And so there are many options, but it does add up.
I certainly see patients who come to me on antidepressants who are also going through menopause or postmenopausal and are still miserable and have some of them tried multiple agents and seen multiple specialists trying to deal with it. And if hormone replacement is appropriate for them and we start them on it, the vast majority of them leave the antidepressants and are fine. Not all. Some people need both, depending on exactly what the source of their depression is, and I'm not the expert in that. But I certainly have patients who I find, no, you got to go back on the antidepressant in addition to what you're doing with hormones.
But it does take a team, and you have to make the investment like anything else. Dr. Yafai, do you have a anecdote?
There's a couple. Number one, I do think this is the value of a primary care doctor. Honestly, I think I always say they're the ones orchestrating things. They're the conductors of your health. They know you, they should know you well. And they should be your touchdown point, right? They shouldn't be expensive, right? It should be generally covered by insurance. So that's your touch point into medicine, right? That's your touch point into getting all these therapies set up. The next step is going to be kind of you can't do too many things at once too, because then you don't know what's working and what's not working. So if you're starting from scratch, right, you're going to start with general therapy, exercise, nutrition, which you can do by Google or Chat GPT these days, right? You can do some of it, not all of it, but then you can find and work with your primary care doctor and a therapist to kind of start you off. If that's not working, if that's not sufficient, if there is a menopause component to it, if there's a hormonal component to it, absolutely you want to get in touch with somebody like Dr. Knox to get the hormone therapy going. If, on the other hand, pain is the derivation, if fibromyalgia, if cancer, if breast cancer treatment, right, is the source, right? You really have to, I think that's the first key is to recognize what the source of the depression is or where the source of all of this is stemming from. And most people are pretty good at that. They're not like, oh, I've been a happy-go-lucky person, and then all of a sudden, I got really sad out of nowhere. Some, people recognize that they tend towards one thing or another, or that there was really a traumatic event in their lives, and that led to this next phase. I think the hardest part to recognize is probably menopausal symptoms, because it's so quiet sometimes, and because you
Sneaks
don't
up.
always know. Yeah, it sneaks up on you, and you don't always. We're still very bad about pinpointing, like, oh, this is the start of menopause. Oh, this is exactly what it is, right? We have to kind of go through and dot our I's and cross our T's in medicine to say, oh, well, you don't have this and you don't have that. You're just starting menopause early, or you're starting it late, or, you're finally having these changes without having menstrual changes, right? Because I think that's what most of us think as being that sign for menopause is, oh, I have menstrual changes. Or if you're like me, you have an IUD in, so you have no idea what's going on with your hormone cycles, right? So there's all these like elements that are really difficult. But the first and foremost is really recognizing what the source is, right? And if you can recognize that source, then you can pursue more actively, whether you want a cannabis pathway or an alternative treatment pathway, or if you want to pursue a typical antidepressant and therapy treatments, or something more like hormones.
Awesome. So the next question is, we talked a lot about like nutrition and exercise, and these are basic things, and sleep is basic, and all three of you touched on sleep. So for women who are having a hard time sleeping, I think the question was about how hormones can help sleep, but I think what each of you talked about, whether it's psychotherapy or mindfulness or CBD, like how can each of those modalities help sleep, and why does that help us with depression? Dr. Elhelou, do you want to start?
Sure. Yeah, I'll go ahead. I'll go ahead and start. And so sleep and depression are actually closely related. So as I had mentioned, during our sleep cycle, we have REM sleep. And during REM sleep, it's actually an important part for emotional processing. And so it is important that we get enough sleep, not only for emotional processing, but memory consolidation. All sorts of things happen whenever we don't get enough sleep. And so it is important, but it doesn't work out for everybody. Some people have trouble falling asleep, other people have trouble staying asleep, and then something I hear come up a lot is anxiety hour, where they wake up between the hours of 1 and 4 a.m. with thoughts about different stressors in their life. And there are several things that can be done that can help with sleep. I will leave it to you to talk about hormone therapy in relation to sleep, but things you can do are like how I talked about exercise earlier. Exercise can actually help with sleep whenever you're working out earlier in the day, or making sure during the day that you're getting some sunlight to really help with your circadian rhythm. And then creating a sleep routine for yourself can be helpful as well. So maybe every night around 7 or 8 o'clock, you drink a specific type of tea, or you take a hot bath, or you read a book, but you get into a routine that signals to your body that it's time to wind down. And then whenever it comes to actually sleeping, really you want your bed to be for just sleep or intimacy related activities. Oftentimes we will watch TV in bed or we'll scroll on our phone, but that's actually not necessarily the most healthy sleep behavior. Now, there are plenty of people that do that and don't have any difficulty sleeping. And if you're not having any difficulty, then that's perfectly okay. But for those that are struggling, really being mindful about your sleep habits and your sleep routine could make a big difference.
Awesome. Thank you. Dr. Knox?
So the sleep issues related to menopause are fairly unique and interesting because for years the thinking was that only women who had actual hot flashes, in other words, woke up sweating, those were the only women that had issues. But what we know now is that not every woman has the hot flash part. Many women now, when you start asking them questions about what's disrupting their sleep, will say that, I just wake up with my heart pounding, or I wake up feeling terrified, or I wake up. That's one form of a hot flash that is caused by estrogen levels plummeting and remaining so. And that, of course, can only be alleviated by bringing those estrogen levels up and making them even. But that sort of sleep disruption is really extremely disruptive because those women have a very hard time going back to sleep, have a very hard time staying asleep, and their REM sleep is totally destroyed. So they wake up in the morning feeling like they're exhausted. And that leads to anxiety, depression, et cetera, et cetera. So,
Yes, question.
Maybe you don't want to answer this, but I've heard things about like bioidentical hormone replacement therapy. Is there a difference between HRT and bio-HRT? And is it harmful to even go the other direction? Because I've heard about other women saying they'll swear by the bio-HRT, and I don't mean to bring up any controversy. So if you say another time, we can talk about another time.
now we understand now that bioidentical hormone replacement therapy is the only way that we protect against the mistakes that we made before that led to increases in uterine cancer, heart attacks, strokes, et cetera, et cetera. And when we use bioidentical hormones and we deliver them transdermally, all of those risks go down, not up.
So synthetic.
Oh, I was going to say, when is the hormone talk? We have one coming up where we will discuss this controversy.
April 22nd.
April 22nd. No, it's good. It is controversial and it's confusing.
That's why I'm here, because I see women who are put on antidepressants instead of.
That's why she's here. And before we
Yeah.
go to Dr. Yafai, the follow-up, there's another question, so I'm just going to do it because it's related. Is there a window when you can start hormones, or if you haven't taken them and you've been in menopause for, I think this person was like 7 years, can you start them then?
Yes. Ideally, we want to start at the onset of menopause or even slightly before. And the reason for that is that first it makes for a smooth transition and you don't have all that time being miserable and sleepless and upset, etc. But it also, that's the maximum medical benefit, is to start it right then. We know that, for example, with respect to bone loss, the most rapid rate of bone loss is in the first year of menopause. So if you're prone to osteoporosis and you wait a year to start, horse is out of the barn. And starting estrogen won't replace what you've lost.
Other specialists think differently about this bioidentical, like an endocrinologist would not let you take a bio-HRT.
I think that's changing, and we will get to
It
that
is, thank
in
God.
that.
Yeah.
But it's part of Dr. Knox's soapbox, because we really do
yeah.
have to change a lot for women's health. Okay, Dr. Yafai, sleep. What can you do for it?
I know. So if you are born of a certain generation, i.e. now, or anytime, if you're under the age of, gosh, I think like 85 at this point, you are sleeping with your phone. Okay. Your phone has become your everything. I mean, is that about right? 85, 80, 85, I think. You are using it as your alarm clock. You are using it as your nightlight. You are using it as your calendar, your email, your phone, it's really your, other appendage. And the problem is when it comes to sleep, people are waking up in the middle of the night normally to get up to go pee, and then they'll check their phone, and then all of a sudden they'll be scrolling and scrolling for an hour before they even recognize that they've been up. And this is happening more and more and more often. And the younger the decade is, the more it's happening. And the younger the decade is, the more it creates more prone to anxiety and depression because of this social media, social anxiety, all of it. And so it's getting tied back really, really, really into sleep. I urge young people, anyone who is under, I don't know,
85.
pick a number, 15 to 18, to sleep with the phone outside of their bedroom if they're able to, right? If we can get these phones to not enter a bedroom, because at a certain point you can't. I've given up. But the younger they are, the more disruptive routine it is created. I have very young patients who have sleep disorders. I'm talking pediatric patients who have sleep disorders and their iPads are in their room. So I'm talking phones, but really it's iPads, it's cell phones, it's anything where you can get on YouTube, for example. And they will just scroll through YouTube for hours on end, and then they can't get up to go to school. And parents are like, I don't understand why they can't get up to go to school. We need a sleep aid. I'm like, you don't need a sleep aid. You need the phone, the iPad, the YouTube to be out of the room. So just as much as we talk about the bed as a place to sleep, right? That's one of our favorite things to say. It is, but it's also really important. I actually so I'm going to date back to 2016 when we had our very first set of elections that were very social media and very hyped up, and there was a lot of emotion tied into that election. And from that point, and then COVID hit in 2020, and then again, last few years, again and again, we see these cycles of news, media, and social media creating this unbelievable amount of anxiety in individuals. And that's what they're designed to do, because you're more addicted to them if you do those things. And then they get better ratings and more money, right? So for a lot of individuals, I will not let them watch news, even TV show news, after 6 p.m. If you are prone to getting anxious about the news, you can only watch it in the morning. Really, even though everybody thinks something's going to happen every minute of every day, news really happens on a 24-hour cycle, really. Unless you're in that industry, there's no reason to be watching it for hours and hours all day. Social media and cell phones get put away. You cannot scroll. You literally, if the worst case scenario is you cannot scroll for the hour before bedtime. Again, this is for people who are prone to sleep issues and sleep deprivation, as well as anxiety and depression. It's probably my number one biggest rule is you cannot do anything else. You can't use your phone.
No, I think that's super helpful. Okay, we have time for one more question, and I know this is directed towards Dr. Elhelou, but you guys may have some input on it too. How much, like we talk about exercise, and it's like 20 minutes a day for cardiac health. What is it for mental health? Like how much do you need to do to get the endorphins? And do you have to cardio, or can you walk, or?
That's a good question. And really, I think it looks different for everybody because we each have different bodies and physical abilities. And so what one person can do and what feels good for one person might not necessarily feel good or be feasible for another person. And so really, like general brain health recommendations, you want to aim for about 150 minutes a week of moderate physical activity. And you can break that up however you want. But if you want to be realistic for mental health, really, I think just going for a walk, right? Maybe after dinner or during lunchtime. If you can just go for a stroll for 10 minutes, that's amazing, right? It really depends where you are right now physically and what is a good goal for you. So maybe for someone that's a 10-minute walk. For someone else that might look like 45 minutes.
It might be just
right?
an increase in what you're doing
Yes.
now when you're depressed.
An increase of what you're doing. And then there are things you can do while you're exercising. If you're exercising for the goal of increasing your mental health, I would really focus on your senses while you're walking. Take a moment to walk through your neighborhood and notice all the beautiful things around you. I mean, it's spring right now, and so there's a lot to look at. So take some time to really look at the colors of the flowers that are blooming, breathe in the fresh air, try to find new things. So when I go for a walk, I try to find something new each time. So maybe I'll identify a new flower in someone's yard that I haven't noticed before. And so really just being mindful while you're walking and focusing on your senses can be quite helpful.
Awesome. I love that.
I'm gonna tag onto that.
Go.
You know,
Yeah.
I just demonized your cell phone. Now I'm gonna say where it's going. So your cell phone is with you wherever you go, and actually it has this automatic health app. So if you look on your health app on your phone, you can see on average how many steps you've taken in the last week, the last month, the last year. If you take that number and add 10% to it, that is your goal for the next week. So I have some patients who only get 500 steps a day because they're physically unable to do more than that. The goal is just adding 50 steps to it. I have some patients who do 5,000 steps a day. The goal is to add 500 steps to it. So that's a really easy way to really ascertain a goal. I'm very goal oriented, to really get like numbers behind your goal and to build upon it, right? Last year I did 5,000. This year I'm going to do 6,000 steps a day. Last year I did, 10,000. This year I'm going to do 11,000 steps a day. And so it really gives you a good way to do it. And I like to do a competition with friends. So I'll give you a quick, easy example. We would sit to watch my son's baseball games that are 3 hours long every week. And it was painful to sit and watch. But we had a group of moms, and every week we would compare how many steps we took. And whoever took the least amount of steps had to bring the charcuterie board to the baseball game. So make it a game, make it fun, right? It doesn't have to be so daunting. It can be really a good time to kind of get that next step. And I find that when you do it together with other people and you have the same goals, that you really tend to work towards it, right? That's the whole point of a coach. That's the whole point of having people that you are held that can hold you accountable, right? For doing these things. Do it with friends.
I like that. I want to add one thing to that because I really love what you said. And enlisting a team really makes a huge difference. And so think about setting small, attainable goals and then enlisting a team and community. So we talked about social connection today. Yeah. And so whether it is your partner that you're living with or a friend that maybe even lives out of state, that is a great thing about these supplements is you can connect with them, say, hey, let's go for a walk together and chat on the phone while we're walking. And so really whenever we are setting goals with other people, we're more likely to achieve them.
I love that. Well, we are at time. I want to thank the three of you so much. This has been very insightful. I know there's still more questions. Anyone who wants to get in touch with any of these three clinicians, you can obviously reach out, or you can reach out to us at the Women's Health and Wellness Institute, and our navigators can connect you and help you find them. And our next, the next one is April 22nd, and that is on hormone balance, and it should be lively. Should be very lively. So thank you all for coming. Thank you guys for your time, and we'll see you April 22nd.